Hello, my name is Molly Sarfolian, and I interviewed Andrea for my individual speech. Andrea is a nursing student at the University of Minnesota Twin Cities. Part of the curriculum for the nursing program that she is required to have is experience working in different types of nursing environments with different types of residents. She did not have a choice of what type of home she would be working in, but eventually she found out that she would be working in a home that provides residential support services for adults with physical, developmental, and cognitive disabilities, as well as memory care for elderly residents. Residents at this facility could range from handicapped to and unable to communicate effectively to residents who were able to carry on a conversation with ease, but still needed assistance in some way, whether it be a learning disability such as dyslexia or autism. While working in the home, Andrea was mainly focused on 4 residents that she assisted with. One of the residents suffered from a stroke recently, and it was hard for them to perform many everyday tasks as well as communicate effectively. When someone suffers from a stroke, they usually experience confusion, they may slur their words, and have difficulty understanding speech. This is because muscles in the face, tongue, and throat are affected. Providing care for a person recovering from a stroke is not easy, as Andrea came to realize. She became familiar with her residents, and it became easier for her to communicate with them. As time went on, Andrea became very comfortable with her interpersonal communication skills with her residents. She would carry on long conversations comfortably, giving both her and her residents opportunities for both speaking and listening to one another. She also needed to apply many concepts from communication frameworks to deal with situations in caring yet professional mannerisms. When she would talk to her residents, Andrea would use lots of hand gestures to further explain the way that she would assist them. When she would listen to the residents' needs, she would have to try and take on the perspective of that particular resident, which is the communication framework concept theory of mind. This job setting applied to Andy's nursing's background because she was always able to provide the best possible care for her residents. She distributed medications to the residents as well as assisted their needs and document their cares. I asked Andrea if she would ever work in a similar atmosphere again when she became a nurse. She responded, "It's hard to say if I would ever work in a similar atmosphere again, perhaps in the far future. It was a very enjoyable experience, and the bond that formed between myself and the residents was meaningful." Overall, Andrea had a difficult job to do when helping these people overcome so much, but it brought her closer to the people she was assisting. From this experience, Andrea has learned how important it is to have companies who give residents such exceptional care and are given opportunities to be active members in the community. She gained a new perspective and learned more about strength, resilience, and patience thanks to her residents.